Labor Day, health officials predicted a surge in COVID-19 cases due to the holiday. And today they are continuing to see more patients as it relates to COVID-19 as well as other illnesses. The state reporting a 14-day average of more than 50% of hospitalized patients across the county. According to the state dashboard, back on June 8th, Kern County had just 5 people in the ICU for COVID. As of yesterday, that number is 68. Now, 23 ABC's Brianna Willis joins us live from Adventist Health in central Bakersfield, where local hospital officials gave an update on what their hospitals are seeing. Brianna.
Both Adventist Health and Dignity Health officials told me today that they're completely stretched thin when it comes to care at their hospitals. And as of today, Adventist Health is now pausing elective health surgeries.
We're just simply out of space, out of staff. And I'm quite concerned about our staff at this point, trying to get them as much help as we can possibly get.
That's the case across all local Bakersfield hospitals. Officials saying staff is stretched thin and patients continue to come in.
So for routine things, people are going to wait hours and hours and hours and hours. It's just not something we can handle as expeditiously as we would in another time frame.
Bruce Peters from Mercy Hospitals also adds that just in the last week, Mercy Southwest Hospital has 109 patients, but is only being licensed to have 82 patients, and their ICU capacity is full. Adventist Health hospitals across the county are also facing similar issues.
Adventist Health is at the peak point of our capacity. We're seeing we're at the place where we're stretched to the maximum. In fact, just today, we've made the decision to pause elective surgeries. So that means people whose surgical care can be delayed safely is going to be paused effective today for at least 2 weeks.
And just over the past week, Walcott says ICU capacity has doubled.
The change that we've seen over the last week or 10 days is that we've seen the number of ICU level of care patients approximately double, from around 20 ICU level care patients to today we have 48 ICU level of care patients across the county.
Walcott also says he believes things may get worse.
And so we're continuing to see that surge rise. We don't expect to see the peak until the middle of October unless our community changes its behavior.
And at Memorial Hospital, CEO Ken Keller says they have already halted elective surgeries, and they have 230 patients with 70 COVID positive and 7 on ventilators.
In place our committee to evaluate and kind of triage surgeries. Each of us has pretty much postponed elective, not urgent surgeries that would require admission overnight.
We reached out to Kern Medical, but they were unable to give us their data at this time. But coming up at 6, we'll have more of the ICU capacity data from both Adventist and Dignity Health. In central Bakersfield, Brianna Willis, 23 ABC News, connecting you.